Section 3. In this section, we will discuss risk factors for workplace violence. Many factors contribute to the occupational risks facing healthcare professionals today. Fundamentally, safety and healthcare focus on the patient, not the employee. Additionally, healthcare is not considered a dangerous profession. Workplace violence risk factors. Healthcare setting. The following are some of the risk factors in the healthcare setting: staff shortages, high staff turnover, increased patient morbidities, exposure to individuals with a history of violence, absence of a workplace violence prevention program, lack of security personnel, prevalence of firearms or other weapons among patients and family or friends, and finally, high-risk settings, which might include prisons or jails, drug and alcohol treatment facilities, or home health nursing. Workplace violence risk factors, patients. The following are some of the risk factors associated with patients: under the influence of drugs or alcohol, in pain, a history of violence, cognitive impairment, in the criminal justice system, angry about relationships with their healthcare providers, and specific psychiatric or medical diagnosis. It's important to note that most people who are violent are not mentally ill, and people who are mentally ill are not necessarily violent. Substance abuse is a major contributor to violent behavior with or without a psychiatric diagnosis. Workplace violence risk factors, environmental. These 4 risk factors are directly associated with the place or environment. 1. The opportunity to gain access or avoid detection. Think about unmonitored entries, stairwells, low lighting, unlocked rooms or closets. 2. Increased stress due to confusing signage, poor weather, difficulty parking, too hot or too cold, and too noisy. 3. The opportunity for objects to be used as weapons. These objects might include furniture, fixtures, decorative items, and medical or office supplies. 4. Staff's inability to appropriately respond to violent incidents. This could be related to a lack of security systems, alarms, or other devices. Also, a lack of training and a prevention plan will jeopardize the appropriate and effective response. Workplace violence risk factors, organizational. The following are risk factors associated with the healthcare organization. Some of them overlap with other categories. However, the goal of this section is to allow you to recognize how risk reduction plays a role in violence prevention in the workplace. As we move through this section, visualize your workplace and what could be modified to make it safer. Organizational risk factors. Inappropriate management and staff attitudes towards workplace violence. Inadequate security procedures and protocol. Lack of training and preparedness. Complicated policies for reporting. And low staffing levels, extended shifts, and overtime. Social and economic workplace violence risks. High concentrations of poverty. Lower economic opportunities. Socially disorganized neighborhoods, high level of family disruption, low community participation, social and cultural norms that encourage violence, and economic and social inequalities. A different kind of workplace violence, violence among coworkers. Short staffing and increased work or patient load can increase pressures at work. A 2011 survey by the American Nurses Association revealed the effects of stress and overwork to be their top safety concern. Although in 2013 a survey showed 80% of violent incidents in healthcare were caused by patients, 3% were caused by coworkers and another 3% were caused by students.